There's not a way to diagnose it, nitric oxide deficiency. It's not part of your standard blood labs. I'm 52 years old and there was no detectable plaque in any of my coronary arteries. The cardiologist and radiologist said they've never seen this.
If they can't test for deficiencies, how do they know if they have low nitric oxide levels?
I'm Jenny Jones, and today I'm joined by Dr. Nathan Bryan, one of the world's leading nitric oxide researchers and experts in cardiovascular health and longevity. In this episode, we dive into blood pressure, the oral microbiome, mitochondrial health, exercise performance, and simple ways to naturally increase your nitric oxide levels. You are listening to the Biohacker Blondie podcast.
All right. Well, welcome to another episode of the Biohacker Blondie podcast. We are here with Dr. Nathan Bryan, and you are an expert in nitric oxide.
Mm-hmm.
So tell us about how crucial nitric oxide is and why you dedicated your entire career to nitric oxide.
Well, I started in this field almost 30 years ago. I had a degree in biochemistry from University of Texas. I was a first-year student at LSU School of Medicine. And a Nobel Prize had just been awarded for this discovery of nitric oxide. And I knew about it from my inorganic chemistry classes as an undergrad, but I really didn't know the implications of it. And then once it was discovered that nitric oxide is a signaling molecule in the cardiovascular system, then that got us interested. Because it's a gas that's naturally produced, but it's gone in less than a second.
Oh.
So the question then was, we knew nitric oxide was extremely important in regulating the cardiovascular system, but once it's produced, where does it go, what does it become, and then how does it signal?
Mm-hmm.
So that's really what got me interested in this. And then, finished my PhD in like 2.5 years, and we created some analytical techniques that we could detect nitric oxide metabolites in different organ systems in the blood and really create a fingerprint of NO-biology in different disease systems. And then once we did that, we had tools really that no one else in the field had. And so we started publishing 8 or 10 papers a year in some really high-impact scientific and medical journals. And because even at the time, even the guys who won the Nobel Prize told me that, Nathan, if we can figure out how to restore nitric oxide production and signaling in the human body, it's going to change the world, because we knew that nitric oxide that every age-related chronic disease was associated with a loss of nitric oxide production. So now it's recognized the earliest event in the onset and progression of disease is the functional loss of nitric oxide. So it doesn't matter if it's Alzheimer's, heart disease, diabetes, autoimmune disease, liver disease, pulmonary disease. The first event is the loss of nitric oxide.
And why is nitric oxide so critical for the body?
Well, it was first discovered to be a vasodilator, meaning that when it's produced in the lining of the blood vessels, it opens up the blood vessels so now you can get better circulation, better blood flow, better oxygen delivery. But it's much more than that. It mitigates the inflammation in the lining of the blood vessels, and it prevents atherosclerosis. It's the molecule that tells our own stem cells to mobilize and differentiate. And it prevents the telomeres from getting shorter at the end of our chromosomes. So we know that shorter telomeres, shorter lifespan, longer telomeres, longer lifespan. And it's what induces mitochondrial biogenesis. So the energy-producing organelles of the cell, if we have adequate nitric oxide, we have more mitochondria per cell generating more energy more efficiently, even with less oxygen. So everything we know about health, longevity, human optimization, and disease prevention is determined by the body's ability to produce nitric oxide.
Why do you think a lot of people don't know about nitric oxide, or it's not talked about enough, especially after 30 years of research and everything, and especially in the medical field and in hospitals, and something that maybe doctors could prescribe and as something to help prevent heart disease or other chronic diseases?
I think there's over 200,000 papers published on nitric oxide in the scientific literature. So it's one of the most researched molecules in medical history. But yet it's not part of the physician-patient conversation because, number one, there's not a way to diagnose it, nitric oxide deficiency. It's not part of your standard blood labs. So you can't draw blood and go, okay, here's your nitric oxide levels like vitamin D. You get, it's 30, let's treat it till we get 80. So that isn't available with nitric oxide because once it's produced, it's gone. I mean, in the research environment, we pick up these metabolites and we can determine kind of nitric oxide production and metabolism, but it's not done clinically. And then two, there's no FDA-approved drugs that are nitric oxide based. Well, I shouldn't say that. There's nitroglycerin that has been used for a couple hundred years for the treatment of acute angina. And
For
these
what?
drugs, acute angina, the chest pain that's associated with obstructive coronary disease.
Okay.
And so, but those drugs were discovered in the 1970s to be metabolized into nitric oxide. They dilate the blood vessels. And then, there's inhaled nitric oxide for pulmonary hypertension, premature babies born with pulmonary hypertension. So the only way to deliver nitric oxide clinically is through these organic nitrates like nitroglycerin or inhaled nitric oxide, which is only approved for premature babies with pulmonary hypertension.
Could I nebulize with it?
Well, it's a gas. I mean, we make nitric oxide product technology that actually produces the gas.
Okay.
So once we figured out that we could generate nitric oxide gas, then I developed a solid dose form of nitric oxide gas. So I'd make a lozenge, you put it in your mouth, and it generates 20 to 30 parts per million.
And how long does it last in the body then? Just a few seconds?
Well, when we produce nitric oxide, we're not changing the physical chemistry of that. So when we release it in the mouth, we release a certain amount of nitric oxide over a certain period of time. And then we look at the pharmacokinetics and pharmacodynamics of where nitric oxide goes, what it becomes, and how it signals. So once we figured out that we could map that out and control and dictate the metabolic fate of nitric oxide, then we could custom tailor drug therapy or product technology to restore the natural production of nitric oxide.
So where is nitric oxide found in the body? Does it just disappear? It is a signaling molecule. So you're saying you cannot test for nitric oxide?
We can. There are functional devices that you can measure.
Okay.
And you can look at what's called flow-mediated dilatation. So with these devices, you can occlude blood flow, and it's primarily done in the femoral artery or the brachial artery, for 5 minutes. So you're basically occluding blood flow into the forearm.
Okay.
And then once you release the cuff, with an ultrasound probe, you can look at how well those downstream blood vessels dilate.
And how much is this test? Is it very rare to find?
They're FDA cleared medical devices, and it's reimbursable. The problem is most physicians and clinicians aren't using it.
Is it expensive? Is the device expensive?
No, they've come down over time. I think they charge maybe $100-$150 for a test, so it's not cost prohibitive.
I mean, so why would someone initially say, I need to start taking nitric oxide? If they can't test for deficiencies, how do they know if they have low nitric oxide levels? Well,
I tell people there's only 2 people in the world who need nitric oxide. There's people who are sick and want to get well. There's people who are healthy and don't want to get sick. So if you fall within one of those 2, I don't need to test.
Yeah.
But what we do is we dose based on need. And so what we rely on are symptoms. So I've been taking my nitric oxide product for more than 25 years.
Okay.
And I take it not because I need it, it's because I don't want to need it.
Okay.
So the symptoms that arise, so we've identified a hierarchy of symptoms that present the longer your body goes and the lower the nitric oxide production becomes. So number 1, you get erectile dysfunction in both men and women. Because if you can't make nitric oxide, you can't dilate the blood vessels of the sex organs, and men get erectile dysfunction, women get female sexual arousal disorder. That's number 1. Number 2, your blood pressure starts to go up. Because if you can't dilate the blood vessels, you got the same volume of blood going through smaller pipes, and simple physics tells us that pressure has to go up.
Okay.
And 2 out of 3 Americans have an unsafe elevation in blood pressure.
Yeah.
Number 3, you get insulin resistance and metabolic disease, because nitric oxide is part of insulin signaling to get glucose into the cell. If the cell can't make nitric oxide, by definition, you're insulin resistant. And 93% of Americans are metabolically unfit. Number 4, you start to develop exercise intolerance, where you get short of breath, can't maintain an exercise regimen. And then kind of the terminal step of chronic nitric oxide deficiency is dementia and Alzheimer's, because it's a vascular metabolic disease. So these are symptoms that manifest, and if you don't pay attention and listen to your body and correct it, the erectile dysfunction turns into high blood pressure, which turns into renal function, which turns into cardiovascular disease, diabetes, insulin resistance, exercise intolerance, Alzheimer's.
Is this also affect the plaque buildup in your arteries?
Absolutely. It's the loss of nitric oxide, the functional loss of nitric oxide precedes the structural changes we see by decades, 10 or 15, 20 years.
Wow.
So if you already have plaque deposition in the lining of your blood vessels, it tells us you've been nitric oxide deficient for many, many years.
Have you tested your own plaque?
Yeah, in fact, just about 6 weeks ago here in Miami, I had a clearly scan done.
Okay.
And so that looks at not only the calcified plaque, but even the soft, vulnerable plaque, which is really what we rely on. And I'm 52 years old, and there was no detectable plaque in any of my coronary arteries.
Wow, that is very
And the
impressive.
cardiologist and radiologist said they've never seen this.
Wow.
Even in young kids, they see fatty streaks.
Wow.
But to have a zero plaque burden for a 52-year-old they've never seen it before.
What about, have you also tested your ApoB and your little lipo-A, I believe?
Yeah, I've done, look, I do
those are
a
all
lot of
great
testing. Yeah.
the heart?
You know, every single lab that I get tested, and usually I'll draw labs usually twice a year.
Wow.
But it's not normal, it's optimal.
Because this is a leading cause of death. Most people have heart conditions. And
Well, cardiovascular disease has been the number one killer for more than 100 years.
Yeah, and a lot of people, they don't know until they have a heart attack or something major.
That's right. That's the
happens.
first sign and symptom is sudden cardiac death.
It's shocking that it's not talked about more because it's a leading cause of death, and most people don't do these simple tests that can really prevent disease and other catastrophes.
Well, we've been misled and misinformed because we've been taught for the past 50 years that cholesterol causes heart disease. And they've been treating cholesterol for the past 50 years, since the 80s, and the incidence of heart disease has actually gotten worse.
Yeah.
So cholesterol doesn't cause heart disease, obviously. So treating cholesterol is not going to prevent heart disease.
Yeah.
And the data are very clear. It does not.
Yeah. What are your thoughts then for Viagra? Is this similar to nitric oxide?
No. So Viagra and those drugs are called phosphodiesterase inhibitors.
Okay.
They do not affect nitric oxide production.
Okay.
But what they do is they potentiate the effects of nitric oxide. And I'll explain the biochemistry. When nitric oxide is produced, it increases a second messenger called cyclic GMP.
Okay.
Which is cyclic, it's a second messenger system. And then there's enzymes in the cell called phosphodiesterase enzymes that degrade cyclic GMP. So when you give a phosphodiesterase inhibitor, you prevent the breakdown of cyclic GMP. So then that potentiates the vasodilation. But without nitric oxide, there is no increase in cyclic GMP. Without cyclic GMP, Viagra doesn't work.
Ah, interesting.
And so we know these drugs were approved in 1998. 50% of the men that are prescribed worldwide Viagra do not respond with better erections.
Wow.
So it's a very successful drug, multi-billion-dollar a year, but it only works in 50% of the people.
Oh, I didn't know that.
So the 50% that don't respond to Viagra, it's because they're not making any nitric oxide to increase cyclic GMP.
So they should include both, if anything.
Well, no, the point is that erectile dysfunction is a symptom of nitric oxide deficiency.
Yeah.
So if you restore nitric oxide production, number one, you can take the 50% of the people that don't respond to Viagra and now make them responsive. And then number two is you eliminate the need for drug therapy. Because if you make nitric oxide, you increase cyclic GMP. Cyclic GMP does its job, mobilizes calcium, relaxes smooth muscle, dilates the blood vessel.
Yeah.
You don't need to inhibit phosphodiesterase enzymes. So that should be the goal of medicine, is to eliminate the need for drug therapy.
Why don't you think, do you think most doctors just don't know about nitric oxide, or the pharmaceuticals are pressuring them to just give that certain medication? Has
I
there
think
been
there's a lack
of saying here's nitric oxide versus the medication?
No, besides what we're doing. I mean, we put all of our product technology, we're developing drugs now through the FDA for heart disease, for Alzheimer's, and we make
amazing.
a topical drug for diabetic ulcers. But even our consumer products, we've put through randomized placebo-controlled clinical trials to demonstrate that we can move the needle on clinically relevant endpoints, like supporting healthy blood pressure and normalizing blood pressure and reversing kidney disease, reversing heart disease. We can improve exercise performance. We can reverse plaque by 11% in 6 months. We can lower triglycerides by 27%. We reduce inflammation by 37% in 30 days.
Wow.
So all of these are published, peer-reviewed clinical studies.
And most people are not taking nitric oxide. Do you have to take nitric oxide, or can you do other things to increase your levels of nitric oxide?
Well, what we hope to do is that we improve the body's ability to make nitric oxide on its own. But if you can't, then you have to take nitric oxide.
Okay.
And that's been a major challenge, too, because there are companies out there who don't know what they're doing that are selling and marketing beets and gummies and chews and calling it nitric oxide. And there's no nitric oxide in beets or gummies or chews.
Okay.
And so that's the misinformation, that's the deception that a lot of these companies are out there, and it's confusing to consumers.
Yeah.
So to answer your question, first we had to understand, how does the human body make nitric oxide?
Okay.
Number two is, what leads to a loss of the natural production? And until you can answer those two questions, you can't answer those fundamental questions like you did. Well, how do we Do we need to take nitric oxide, or what can we do to increase its production? So there's an enzyme found in the lining of the blood vessels. We know how that enzyme makes nitric oxide. There are things that lead to its uncoupling and loss of function. So we can restore that. You can do that through exercise, a good diet, balanced diet in moderation, elimination of sugar and simple carbohydrates, and 20, 30 minutes of sunlight a day. So all those things can activate the enzyme. And then number 2, we've identified some bacteria that live in the mouth, in the crypts of the tongue, that take inorganic nitrate that we get from our diet or from our blood supply from the oxidation of nitric oxide. And then these bacteria metabolize it into nitric oxide. So if we eat a good diet, if we have good oral hygiene, if we don't use fluoride, if we don't use antiseptic mouthwash to kill the bugs, and we don't use antacids, then we can activate this nitric oxide production system. But then here's the problem. 73% of the people in the U.S. have fluoride in their drinking water.
I know.
2 out of 3 Americans use antiseptic mouthwash. 200 million prescriptions written for antacids every year. And then 3 out of 4 Americans report taking an over-the-counter antacid.
Oh, my God.
So we're completely destroying the microbiome. We're completely shutting down nitric oxide production. And we published more than 10 years ago, if you use mouthwash, it's killing the good bacteria, decreasing nitric oxide production, and your blood pressure goes up. And high blood pressure is the number 1 driver of number 1 killer of men and women worldwide.
I know. I knew someone who just stopped using mouthwash and was eating spinach and beets. And I think those were the only 2 things. And his blood pressure went way down just by doing those few things. And he said, of course, I think he had some extra feelings down there as well.
Yeah. It's amazing. Those simple changes can be life-changing.
And fluoride is still in a lot of toothpaste.
Yeah.
That's shocking.
It's a huge problem. And what we're finding is that, and we published on this in 2019, people who have resistant hypertension, what that means is you have high blood pressure and you're put on a prescription medication.
Okay.
A blood pressure medication, whether it's an ACE inhibitor, an ARB, or calcium channel blocker. But yet we know from the clinical data that 50% of the people that are given blood pressure medicine do not respond with better blood pressure.
Wow.
So they're resistant to the therapy. It's resistant hypertension. So what we're finding is their hypertension is due to oral dysbiosis. And then we ask them, do you use fluoride toothpaste? Most people say yes. Do you use mouthwash? 2 out of 3 people say yes. And are you part of the 73% of the municipalities in the U.S. that have fluoride in their drinking water? And then we tell them, okay, eliminate fluoride, eliminate mouthwash, get a home filtration system, feed the good bacteria, and then amazingly, their blood pressure comes down. And they can get off prescription medication. And that's never happened in the history of Western medicine. It's always, I'll put you on more medication. But there's never the conversation of how do we get you off medication?
Filter your water.
Filter your water. Stop using fluoride. Stop killing the bugs in your mouth. Support the microbiome.
I know.
Don't kill it. Get off antacids. Exercise. Get sunlight. Intermittent fasting. It's really that simple.
It is. And it's you can do a microbiome test, your oral microbiome too, to see what's going on.
For sure.
And it's not that expensive. You can find out which bacteria you need more of and everything. So, which is also very critical. And it's a simple test that really can save your life and also be preventative. And you do it once, I don't know, it's $100.
Yeah. Well, we're working with a lot of the oral pathogen test because a lot of the tests are looking at specific pathogens. And so they've used that to dictate therapy. But what we're finding is sometimes the antiseptic therapy is worse than the pathogen load because of the collateral damage of killing the good bacteria.
Day.
So now we're trying to, in these oral pathogen tests, not just test the presence of the pathogens, the presence of the good non-pathogenic commensal bacteria. And then dictate therapy to selectively kill the pathogens without killing the good guys.
Yeah.
And then so we're working with that. We developed a nitric oxide-friendly toothpaste, fluoride-free, that's targeting the oral microbiome. We're going to launch a nitric oxide-friendly mouth rinse probably in the next 3 to 4 months.
Oh, amazing. Yeah, I'm a big fan of, I do hydroxyapatite. If anyone doesn't know about hydroxyapatite, you can switch that out from your fluoride and it remineralizes your teeth.
So ours is hydroxyapatite-based, fluoride-free, prebiotics. We create an environment in the oral cavity where these bacteria can flourish and grow. And when you do that, they don't allow these pathogenic, opportunistic bacteria to take hold.
And I don't think people realize within the mouth you have those nerves, and that all goes to your organs and to your brain and everywhere. So it impacts your whole
For sure.
body, and can be very detrimental if you don't have good bacteria in your mouth.
That's right. It's called the oral systemic link. Right?
Yeah.
If you have bad oral health, you have bad systemic health.
What about your gut health? So does that affect your nitric oxide levels, certain bacteria in your gut?
Well, sure, because every time you swallow your saliva, you're inoculating the gut. You're swallowing bacteria in your saliva. So if you have bad bacteria in your saliva, your oral cavity, you swallowed, it causes dysbiosis in the gut. But it all starts here in the mouth, and then everything else downstream will feed from that. So if you have poor oral hygiene, you're going to have poor gut hygiene and dysbiosis.
Yeah. So, so we talked about what depletes it. So this is, and then how do we increase? So would you suggest? I know there's L-citrulline, arginine, precursors, and then there's beetroot powder. What else is there that they say can help increase nitric oxide? So
I mean, those are the big ones. Those are the big categories. It's arginine, citrulline, which are amino acids, and then there's the beet powder kind of myth that produces nitric oxide.
Okay.
So number one, arginine and citrulline, there's no need for those. So these are amino acids that they're called semi-essential amino acids. So the body makes them through the urea cycle, and you get it from the breakdown of proteins, whether you're eating animal proteins or plant proteins. So there's never a deficiency of arginine or citrulline.
We never have a deficiency?
We never have a deficiency. There's only one
I know
human.
in the fitness industry too, they always say these amino acids are great for cardio.
Well, it's because they don't understand the science, and there are companies out there who are selling those.
Yeah.
Who try to create a demand for them.
It's kind of when I think I heard about nitric oxide first was probably the fitness.
Yeah, in the 90s, once the Nobel Prize was awarded, there was a huge kind of awareness around nitric oxide, and it was, part of the discovery pathway was arginine is converted to nitric oxide. So all these companies started selling arginine-based products. And then in 2010, we published a paper showing that the cell uses L-citrulline that then converts to arginine. Arginine goes to make nitric oxide to get citrulline as a byproduct, and it's recycled and shuttled through this molecular complex. So then companies started putting citrulline in the products. But citrulline is a byproduct of nitric oxide production. It's not a precursor.
Ah, interesting.
So an interesting way to tell if a company knows anything about nitric oxide science or simple biochemistry. If they have arginine or citrulline in their products, the company has no idea about the science.
I had no idea.
Most people don't.
That helps with nitric oxide.
No.
And beetroot powder?
Beetroot powder, again, in the early 2010s, there was some really good data coming out that if you standardized a nitrate in the beet powder, the beet juice, and you had the right oral bacteria and you had sufficient stomach acid production, you could consume this, and 90 minutes later, you could start to see an increase in nitric oxide production. And it could improve exercise performance. It could lower blood pressure, especially in hypertensive patients. So once those data came out, all these companies started buying beet powder and putting it in capsules, putting it in tubs and calling it nitric oxide. And so what I did is I started testing these products, because what happens is, and most consumers don't understand this, how do you take a beet that's grown in the ground and get a powder out of it for consumers and end
Try
product?
it out.
Yeah, you harvest it, and you make what's called a high brix concentrate. It's kind of like a molasses, like a really thick viscous. And then they put it through usually a high heat, a high pressure drying. And a lot of the things, or most of the things that make nitric oxide are water soluble. So what happens when you dry it? You lose it in the water.
Wow.
So now all you have left is a dead beet powder. It's dead beets. There's no nutrient value. There's no nitric oxide activity. All the water-soluble nutrients are gone. And so you're left with an earthy, dirty-tasting beet that really provides no nutrient. Actually, it provides a lot of oxalates, which cause kidney stones, can cause gout, can cause inflammation.
Oh, my God.
And it turns your pee pink. It turns your feces pink. But there's zero nitric oxide benefit.
So how do I get nitric oxide? How do I increase my nitric oxide levels?
Well, I mean, what I've done over the past 25 years based on the discoveries is we make a beet powder that actually produces nitric oxide.
How?
Well, we start with the soil conditions, making sure there's enough nitrogen in the soil.
Okay.
We harvest the beets, and we put them through a drying process that preserves the nutrients. And then, more importantly, we ferment the beets, because nitrate is inert in humans. Right?
Is what?
Is inert. I mean, the human body cannot metabolize nitrate.
Okay.
And that's why it's dependent upon the oral bacteria. So as we just discussed, even if the beet powder that you were taking had enough nitrate, most of the people don't have the right oral microbiome because they have fluoride in their toothpaste, fluoride in their drinking water, or they're using antiseptic mouthwash. And again, this entire cycle and production pathway is completely inhibited by antacids. So with all the people taking antacids, then you're disrupting this nitric oxide production pathway.
Oh my gosh.
And that's why beets, there's companies out there making hundreds of millions of dollars advertising on TV and radio. This beet powder, these gummies, these chews, take it, it's nitric oxide. I've tested all of them, and there's zero nitric oxide coming off of any of those.
Oh my.
Zero.
Isn't there some benefits to beet powder? Like I've even seen like Mark Hyman post like beet powder in his smoothies and everything.
I mean, look, there's fiber, certainly. There's betaine hydrochloride. There's betalins, which have antioxidant activity.
Okay.
But there's other things in beets. But what I do is my metric is nitric oxide.
Yeah.
And how is this contributing to the natural production of nitric oxide in the body? And obviously, there's steps in this process that are required to activate nitric oxide production. And most of the commercial beet powders on the market they don't check any boxes. There's zero nitric oxide benefit.
So I can eat beets and get the benefits of nitric oxide.
Well, potentially. And again, we published this paper in 2015. It depends upon where you live and the vegetables you're growing.
Okay.
You're eating.
Yeah.
Because
the soil conditions.
The soil conditions. Because we reported that vegetables in Los Angeles and Dallas have, 10, sometimes 50 times more nitrate in it than the same vegetable grown in New York or Raleigh or Chicago.
Too.
From
I think
celery.
Celery, yeah. It's just shocking. I wouldn't think LA would have great soil conditions, honestly.
Well, it depends upon, and that's conventionally grown vegetables where they add fertilizer to the soil.
Okay.
But in organically grown vegetables where you can't add nitrogen-based fertilizers, they have about 5 to 10 times less nitrate.
Interesting.
So if you're eating organic vegetables, you're not getting sufficient nitrate to improve nitric oxide production.
So what foods would you suggest to increase my nitrate? Are you a big fan of spinach, celery, beets?
I mean, look, if you have the ideal conditions, if you have the right oral bacteria, these nitrate reducers, and you have adequate stomach acid production.
Yeah.
The darker the green vegetable, the higher the nitrate content. Because you can see this, if you fertilize your yard, you see the grass turns darker green. If you fertilize your garden, the vegetables become darker green. That's because of the nitrogen and the nitrate. So if you have a dark green vegetable like kale or spinach, that's higher the nitrate content. But again,
But then I don't want to eat non-organic.
I mean, that's the question, right? You want to eat organic because you're not getting the herbicides or pesticides, but the organically grown vegetables are nutrient depleted.
Yeah, I mean,
so it's very it's very difficult to stay healthy, right? I think you and I both know this.
It's
because we live in a toxic world. The food we eat is nutrient depleted and herbicides, pesticides.
I agree.
But I think to answer your question, it's not. I think it's less about what we eat and more about what we don't eat.
Yeah.
And I think sugar's the problem because sugar's the toxin. Ultra-processed foods.
It destroys your microbiome as well.
It destroys the microbiome. It lowers the pH of the saliva and creates an environment for the caries-causing bacteria, the periodontal bacteria that causes gingivitis and periodontal disease. And, sugar sticks to things, right? It's sticky. So when we elevate it in our blood, it sticks to hemoglobin. And we can measure that as hemoglobin A1C.
Yeah.
But it also sticks to enzymes and proteins. It sticks to the enzyme that makes nitric oxide, and it glues it together. So when you glue an enzyme together, it can't undergo a conformational change to transfer electrons to make nitric oxide or any enzymatic reaction.
Wow.
So if you eliminate sugar, then you've released the brakes on the body's ability to make nitric oxide.
I know. This whole thing with cavities and it's not normal. And I remember listening to a podcast where they said they found the teeth of some animal, out in the wild. No cavities, no rotting teeth.
And they're not brushing their teeth.
Yeah, they're not brushing their teeth. And now dogs, from the processed food now that animals are given, they all have rotting teeth now. And this isn't normal. Animals and humans probably should not have any rotting teeth, but we destroy the saliva, the microbiome, everything. And then now everyone is having complications with their teeth root canals, which also have a huge impact on your health and everything. So, it's
Well, like the other thing too is, there's these fads that occur in the supplement industry.
Yeah.
Is how do we deliver nutrients? You can do it through pills, through powders, and then, 15 years ago, these gummies and chews came out.
Yeah.
And now people are getting their creatine, their protein, their...
I know. It goes on and on with these gummies. Don't get me
because
started.
those are the
with
worst things in the world. I could even imagine. It's
such
seed oil and sugar.
I know. It's like it's all marketing, and I see people buy the gummies all the time, and I'm like, you're adding 10 weird ingredients to your supplement, and
you can't even deliver the active amount of an ingredient in a gummy or a chew.
Yeah.
So if I wanted to create the ultimate marketing ploy and fraud scheme and deceive customers, I would sell gummies and chews.
I know, and it works though, and it frustrates me because I see so many people wanting the gummies. They're just like, oh, I like taking the gummies.
Well, because they taste good. Why
Yeah.
they taste good? Because they're full of sugar.
I know.
The last thing you need.
And you're just trying to get your supplements and get, some deficiencies.
But these companies do it because sugar is the most addictive substance in the world. So
It's
if you make your
bad.
customer addicted to your product,
They'll keep coming back.
they'll keep coming back. They keep buying
Yeah.
because they're addicted to the sugar and they're getting no nitric oxide, getting no benefit from it. Doesn't matter if it's creatine they're getting through the gummies or other
Every
nutrients.
supplement company right now is coming out with a gummy, and I'm like, the ingredients, and I'm thinking the amount, the quantity of the supplement, is that even being there? And then the processing, the heat and all that, I'm like, does that even stabilize the supplement, or is it destroying the supplement?
It destroys it. And two, you've got the sugar molecule that binds to, like the best example, and I've tested this, is grapeseed extract. Companies are selling grapeseed extract in a gummy or a chew. But grapeseed extract, kind of the epicatechins and these molecules that bind to receptors on cells, the cells they can't even activate the receptor because it's bound by the sugar in the gummy. So you completely inactivate the ingredient that you're trying to deliver by putting it in a gummy or a chew. And that's the problem with these supplement companies who don't understand science.
Yeah. And they're not doing the testing behind it.
They're not doing the testing. They take clinical trials done on the ingredient itself and then put it in a gummy or a chew and go, oh, this is clinically proven to do this. No, that ingredient was at a certain dose, but they never do a clinical trial on the finished product. Because number one, it's costly. Number two, they may do some preliminary tests and realize that it doesn't move the needle. But they can use the published clinical trial from the ingredient company and call it good.
Yeah. It's very, very corrupt space.
Now, look, there's some
Lots
really,
of money.
really bad actors in the supplement space that,
Yeah.
market science and all that, but really, in the face of the science, ignore it, because if they recognize the science, they would realize their products don't work because they can't work.
And they're making a fortune, so they don't even want to
Oh, yeah, hundreds of billions
They
of
don't
dollars.
even want to know.
Yeah.
So have you seen those nitric oxide strips to test?
I developed those.
Oh, okay. You did. And do you have them with your company?
No, and here's why. So 15 years ago, when I started my first company, the question was, how do we know if we need nitric oxide? Valid question. And because there's not standard blood test, I developed a salivary test strip.
Okay.
Because we understood that when nitric oxide is produced, it's oxidized to nitrate, it's reabsorbed in the kidneys, concentrated in our salivary glands, and then if we have the right bacteria, we can reduce that to nitrite, and then we can detect the nitrite in the saliva. And so this is some old chemistry that I put on the end of a test strip. I filed patents when I was still at the University of Texas Medical School in Houston. And then several years later, we abandoned the patents because it was old chemistry, and I didn't know if it would take a lot of money and time to get a claim on that chemistry. So I abandoned the patents. And then the other thing was we were finding that people would test positive that had all the symptoms of nitric oxide deficiency. So they were overweight, they had high blood pressure, they were diabetic, they had erectile dysfunction. And we would test them with a test strip, and they'd light it up, and it says optimal. So then they go, oh, I'm great. I'm optimal. I don't need nitric oxide. But yet they had all the hallmark symptoms of nitric oxide deficiency. And then we find, once I started looking, I go, well, what's going on here? And then we look at their oral cavity, and they've got an active oral infection.
Oh
So what we're picking
gosh.
up with the test strips is an active oral infection. So it's a local immune response, and but systemically they're completely devoid of nitric oxide.
Oh my gosh.
So that's what led me to abandon the patents on these strips.
wow.
And now you've got several companies out there
Companies.
that market these, and they're calling them nitric oxide test strips, but they're not detecting nitric oxide.
Wow.
And again, that's the difference between companies who understand science and who don't understand science, who are out there trying to be in the nitric oxide field when really they have no business being in the nitric oxide field.
And so you've seen a lot of other supplement companies promoting nitric oxide. And have you tested their supplements
I test every product on the market.
And most don't have nitric oxide.
Zero.
Oh my gosh. Okay. Now
and I've been sued by these companies. These companies have come after me.
I won't ask any specifics, but I'm curious now. I won't call them out, I guess.
Yeah, but people know. People know.
So you also have skin care with nitric oxide.
Yeah.
So how does that work? Does our skin need nitric oxide as well?
For sure. The skin is an organ just like the heart or the liver or the kidneys or the sex organs. Right? It's one of our largest organs, and it has to have adequate blood supply, microperfusion. And so if we're not delivering good oxygen, blood flow, and circulation to the skin, it fails, just like the sex organs or the heart. And so you lose hydration, you lose collagen, fine lines and wrinkles start to appear, start to get dermatitis, even acne, bacterial infections. And so the impetus for me to develop a topical nitric oxide, I never intended to get into beauty or aesthetics.
Yeah.
But what happened in 2014, my dad had a car accident in 1984.
Okay.
So he was a paraplegic, mid-back down, T11 injury. And so he developed these decubitus ulcers, these pressure sores on his backside. And in 2014, he developed a stage 4 ulcer that got infected. He got septic and almost died. And so once we got him through the infection, 10 days in the hospital, IV antibiotics, then the question was, how do we heal this wound? And so I took him to all the wound care docs that I could find and put him through 40 sessions of hyperbaric oxygen treatment. And they said, you will never heal this wound on a 60-something-year-old paraplegic diabetic patient. And they basically gave him a death sentence, and I just refused to accept that. So I started treating the wound with nitric oxide. I would create a nitric oxide releasing gauze that I would do a wet to dry dressing change twice a day. But I would create an environment in there where it would produce nitric oxide. Then I'd cover the wound bed. And within 6 weeks, I got like 50% closure of that wound.
Wow.
Because if we're producing nitric oxide in the wound, non-healing wounds don't heal because there's no circulation to the wound bed. And without circulation, your immune cells can't get there, so they're prone to infection. So if we know that we're not getting adequate circulation from the inside, so I started applying nitric oxide to the outside. We're dilating the blood vessels, recruiting capillaries, getting blood flow to that wound bed. It's killing the bacteria because nitric oxide is antibacterial. And then so if you're getting blood supply to the wound, causing a hyperemic response, killing the infection, mobilizing stem cells, the wound heals itself.
So your dad
No, within 6 months, I completely healed a 4-year-old non-healing wound.
Oh my
Then the wound care docs were like, what in the hell did you do? What is this?
Oh my
God. It's nitric oxide. So then I had to wait. How can I make a stable form of nitric oxide to deliver topically? And so that created this dual chamber delivery that you take one pump from each side, and when you mix it together, it starts the chemistry and starts to generate nitric oxide gas.
Oh my gosh.
So now when you apply it to the skin, it's producing nitric oxide. Your skin turns pink. We're improving blood flow. I think we've got 7 published clinical trials on the serum. It's an incredible.
You see a big difference?
Huge difference.
Wow. Anything with like discoloration?
Yeah, the age spots disappear. We've got acne, rosacea, any type of dermatitis, wound healing response, even polycystic acne, teenage acne.
Wow. What about for the hair? Would that help?
The hair. No, I think there is.
Dip it in my body.
Here's what we know. I don't think hair loss can be due to loss of follicles, which can, in some cases, be due to loss of adequate blood supply.
Yeah.
So if we can maintain perfusion of the follicles, we can maintain follicular growth and the health of the follicle and hopefully prevent hair loss. We don't have any studies on that. But here's what we do have data on. In hair transplants, when you're transplanting follicles to parts that are deficient, part of the protocols is to add our topical nitric oxide to get blood flow to that newly transplanted follicle. So you improve the graft success, and you maintain the health of the follicle so that it can continue to grow and flourish and regrow hair.
Do you guys have a hair serum or anything?
No, we just use the typical nitric oxide serum that we use on the face.
Okay,
So it's but I had a hair transplant a year ago.
Oh, you did?
And as part of the protocol, we transplant the follicle. Yeah, Alan Bauman.
Oh my gosh, amazing.
Yeah.
He's the
No,
best.
so Dr. Bauman uses our serum, and we soak them in the the exosomes. We've actually taken my own stem cells from the follicles and banked them. So now if I go back, I can do my own transplants.
Yeah, I did the acorn secretome.
Yeah,
So I've been
indeed.
going every month and doing the microneedling.
Yeah, but immediately after the follicles, I did 45 individual follicular transplants. And immediately after, we apply the serum all over the transplant site. And you can the skin actually turns pink. So you can actually see that product working right before your eyes.
Wow.
So it's establishing blood flow to a newly transplanted follicle to which there's no established blood flow.
I had no idea. You did not tell me about this.
Yeah.
I'm going to ask for a little serum next time.
No, it's amazing. And we're actually looking at it now for, as part of a protocol. And maybe we can get FDA approval as a kind of an adjunct therapy. Because we know, look at whether it's a transplanted hair follicle or transplanted kidney or transplanted heart or lung, you have to establish blood supply to that. And you have to prevent what's called the reperfusion injury. Like in transplantation surgery, most of the time it's not the lack of blood supply that causes damage to a transplanted organ. It's when you reconnect the blood supply and you get that hyperoxygenation response, causes a lot of oxidative stress. So if we can prevent the ischemia reperfusion injury, which nitric oxide is known to do, then you can improve the success of the graft and the transplant.
That is so cool. Okay, I'm glad I asked you. So what do people start noticing once they start taking your nitric oxide supplement? Like what do you start seeing in people that are, starting to make these changes?
Number one, if you have if your blood pressure is elevated, your blood pressure will come down.
Wow.
So that's huge. And some people, you may not notice it. Right? If you've got a blood pressure of say 140 over 90 and it comes down to 120 over 80, you may or may not feel that. But certainly you can measure it with the blood pressure cuff.
Fitness?
Yeah, fitness. The perceived exertion of their workout is much less. They feel like they can go longer, stronger, faster. Their insulin sensitivity is going to improve. So their fasting insulin, fasting glucose will improve. Sexual function improves.
Hormones?
Not necessarily hormones. I mean, nitric oxide is a hormone itself, and there's a lot of crosstalk between hormones. But we don't. If you're low in testosterone, you take nitric oxide. We're not going to suddenly improve your testosterone.
Okay.
There's different things, or estrogen in women. But I think there's a way to better regulate the hormones, and you get better response to hormone replacement therapy if you're first normalizing and standardizing your nitric oxide. So we call it a foundational molecule. It's where you start.
Yeah.
Because if you don't start there, and you ignore nitric oxide and you give testosterone replacement or estrogen replacement in women, you fail to regain the cardioprotective benefits of the hormones. So you start with nitric oxide because that's foundational. You improve circulation, improve blood flow, and tissue oxygenation. Now the endocrine glands that secrete the hormones are actually getting a better supply or sample of what's going on systemically. Because if you don't have good circulation to the testes, to the ovaries, or to the thyroid, it's not getting a good sample of really what's going on in the body.
Yeah.
So how can it regulate the hormones if it's not getting a sample of what's occurring in the body because there's reduced blood flow, microvascular disease. And so if you open up the blood vessels, get better circulation, now the endocrine glands, the hormone glands, can respond and better regulate what's optimized in the human body. And again, it's giving the body what it needs so the body can respond.
Yeah. What is your then typical protocol? What is your daily protocol to make sure your nitric oxide levels are
Me
high?
personally,
Yeah.
I do an 18-hour fast every day.
You do?
Every day. And then once a week I do 24 hours.
When do you stop eating? When do you start eating?
6 o'clock. 6 p.m.
Okay. And you start eating around 10 or so?
No, 12 the next day.
Wow. Okay.
Yesterday, I was on a 24-hour fast.
Really?
So usually Mondays I'll do
and
a
this
24.
can increase your nitric oxide levels?
Well, what
Or
it
just-
does is it's improving the energetics, right? So it's getting my glucose down. It's decreasing my fasting insulin levels. So insulin is a driver of inflammation. Mm-hmm. And so if you have elevation, and a lot of times it's not the hyperglycemia that causes all the damage. I mean, it's damaging, but it's the hyperinsulinemia and hyperglycemia in combination that drives inflammatory response. So number one, 18-hour fast. It's caloric restriction. And I think it's inducing these longevity genes. I don't think, I know, because that's what the science tells us. I work out every morning. As soon as I wake up, I'll actually take my beet powder because it's a good pre-workout.
Okay.
Gets my blood going, gets my circulation going. And then typically, well, when I'm in Miami, like this morning, I'll go out, watch the sun come up, get that first sunlight. And a lot of times I work out on the beach, walk on the beach. And then I read scripture. I do daily prayers, meditation, kind of, how am I going to execute the day? What's my strategy? What I get accomplished today? And then kind of what's my strategy for executing that? And then what else? So yeah, that 20, 30 minutes of sunlight a day. I do nasal breathing.
Oh, interesting. Yeah.
Because there's a high concentration of NOS enzyme in the nasal epithelium that produces nitric oxide gas.
I know if someone has like a deviated septum or anything, would that be a cause of low or depleted levels of nitric oxide?
The main contributor are mouth breathers. If you're mouth breathing, you're completely shutting down your nitric oxide production.
Interesting. I didn't even think of that, but
yeah, because you're bypassing the nitric oxide production in the upper airways, the sinuses, the nasal sinuses, but you're also changing the environment in the oral cavity. Because when you're fully oxygenating, you're lowering the pH, and you're completely changing the ecology of the microbiome.
I think it's a big issue for most people. Most
it's a
people
huge
cannot
issue.
breathe through their nose, and they just breathe through their mouth all the time.
Yeah, so you can mouth tape at night, but before that, I would always recommend go see an airway specialist, because if you've got an obstructed airway and you tape your mouth,
Could be a little dangerous.
Maybe not a good idea.
Yeah, a lot of people can't mouth tape because of that.
Yeah, but no, those are the big things. An 18-hour fast, exercise every morning, nasal breathing, sunlight, exercise, movement. And when I eat a high protein meal. I eat, a lot of red meat, some chicken, very little seafood. And I typically try to eat kind of low glycemic index carbs, if I eat carbs.
Any smoothie or anything to increase your nitric oxide levels?
I take my beet powder in the morning.
Okay.
I also take capsules of organ meats.
Oh,
wild
you do?
bison organ meat.
Which one?
It's wild bison organ meat.
Okay, yeah.
Because I've tried to eat organ meats. I harvest my own beef, and I always get the heart, the liver, and the pancreas and all. But I can't eat it. I know it's good for me. So what I do is I buy this wild bison organ meat in capsules. I take 6 capsules of those in the morning.
Okay.
Doesn't break my fast. And then I take salmon roe as part of my...
Wait, where do you get your salmon roe from?
A company called Wild Mamas.
Okay.
They sell it as a prenatal.
Oh, really?
So it provides all the nutrients to support, a woman who wants to get...
Omegas, too, are hard to... It's hard to... I'm not a big fan of omega-3 supplements.
No, because most of it is oxidized and it's rancid fish oil.
Yeah.
It's
I'm
oxidizing.
trying to eat some more salmon and do some things to get my omega-3s.
And then I take some algae products. So I try to get, to balance nutrients from the sea, nutrients from the land.
Yeah.
So I get the chlorella, spirulina products. I'll take a handful of those. But that's kind of my supplement routine. Then I take magnesium at night before I go to bed.
So do you think everyone should be taking a nitric oxide supplement?
Absolutely.
And what would be, I guess, your 5 top suggestions for people today that want to increase their nitric oxide levels?
Well, you got to stop doing the things that we talked about that disrupt it.
Yeah.
If you're using a fluoride toothpaste, you have to stop. Fluoride is a neurotoxin. It's an antiseptic. It shuts down your thyroid function.
Do you have a favorite toothpaste?
Yeah, I created one myself.
Oh, yours.
Because the problem was...
Which I haven't tried, yeah.
Yeah, 25 years ago, I understood the dangers of fluoride. And so I've been using a non-fluoridated toothpaste for 20-something years. But as we were doing these experiments, and I was doing tongue scrapings and analyzing my own microbiome, there were still things that I didn't like, and I was seeing in there, and I didn't have the diversity that I was looking for, that we saw in other people. And when I looked at the toothpaste, there were still detergents in there. There were still some things that were destroying the biofilms and kind of causing dysbiosis. So then once we learned more about these bacteria and what the environment that they liked in culture conditions, then I thought, can we create a toothpaste that can mimic the culture conditions that we know these bacteria can grow and flourish in?
Wow.
So it took me probably 3 or 4 years to crack that code, but we make
this toothpaste.
Yeah, it's called Breath of Life because nitric oxide is the breath of life.
Oh, I love that.
But it's fluoride-free. It's hydroxyapatite based.
Yeah.
But we put it's an amazing toothpaste. It leaves your mouth feeling silky, fresh.
Oh, nice.
My dental checkups, I went to the dentist for the first time in 3 years, probably a year ago, because I just didn't have time to go for my annual checkups. And when I went in, they go, it looks like we just cleaned your teeth yesterday. They go, what are you? I had 0 plaque, 0 pathogen burdens. There was no pathogens in the dark field microscopy. And they go, what are you doing? And I said, I've been using my toothpaste. And now we've been able to replicate that. People use the toothpaste to go to the dentist and they go, we've never seen a oral hygiene like this.
Wow, that's incredible. Yeah, I've tried many clean toothpaste with hydroxyapatite. I think the hardest part is when I tell people about clean toothpaste and it's not like, it doesn't foam and they're used to this certain like feeling.
That's right.
And so I think that's the hard transition for
it people. Is and we struggled with that because we wanted people, people want a good clean feel after their toothpaste. And they feel like it's not sudsy, they're not getting, and there's not, their that teeth minty, don't feel clean and minty.
Yeah.
So we balance, kind of manage the expectations of what people are used to, what they want to feel, but do it in a way that doesn't destroy the bacteria, that actually allows for the flourishment and the repopulation of the bacteria that may or may not be present when they begin, but once they start the toothpaste and stay on it, we're completely improving the diversity of the oral microbiome. Wow. We're seeing their nitric oxide levels go up, and we're seeing their blood pressure come down.
Wow.
So we've had probably maybe hundreds of reports now of people contacting. They go, Nathan, all I did was change to your toothpaste, and I got off my prescription blood pressure medicine.
Wow, that is crazy.
So the bacterium, the microbiome is an extremely potent target.
Yeah.
To restore normal human physiology.
Yeah. Even though we were talking about the stool, transplant.
Yeah, the fecal transplant. I did that and it completely changed, everything about my digestive system. And people with even, Clostridium infections or C. diff. The only way to cure it is through a fecal transplant. Antibiotics typically won't eradicate it.
I think so many people struggle with bloating and gas and a lot of digestion issues.
It's a microbiome issue.
Yeah. And it's just like, it's amazing your story with that, but the gut, your bacteria influences every part of your body. It's like...
We're 10 times more bacteria than we are human.
Oh, yeah.
So if you're killing off all the bacteria, you're killing the human.
I know. So where can everyone go find you and your supplements and your toothpaste?
Well, I'm less interested in selling products and more interested in providing education so consumers understand what companies are providing valid scientific-based products and whether other companies are deceptive. But I send people to my YouTube channel. It's Dr. Nathan S. Bryan Nitric Oxide on YouTube. I'm on Instagram, Dr. Nathan S. Bryan, and LinkedIn. I published, I think, my 6th book last year called The Secret of Nitric Oxide, Bring the Science to Life.
Oh, okay.
By Brick Tower Press and my agent, Alan Morrell. But it tells the whole story of nitric oxide, from its discovery, what it is, takes the very complex science and kind of distills it down into something that's easily understood, but it also tells my own personal journey of discovery and how we were able to make these discoveries and lead to product development and now drug therapy that we're developing.
Wow.
But it's, it's turned out to be a really interesting story. So it's been a bestseller on Amazon. And so I encourage people to read the book. And then... for our products, it's n101.com. That's the letter N, number 1, letter O, number 1.com.
Okay, amazing. Also, I have Pulsetto is sponsoring, so they're giving these to my guests. It's a vagus nerve stimulator.
Yeah, no, I know about this.
Have you tried it?
I've tried this at a number of conferences, but I've never pulled the trigger and got one. So
okay,
wow,
so you can try it. It's supposed to help reduce stress and sleep and everything.
No, I've gotten pretty good at managing stress. I made a conscious decision probably 7 or 8 years ago that I'm not going to worry about things I can't control.
Yeah.
And if I can't control it, then I'm not going to worry about it.
Yeah.
And then once you realize how little you control, you don't worry about it. I don't worry about anything. Because worrying it doesn't change it.
I know, and for me, I can help in the health and longevity space, but politics, I can talk about it, I can get angry about it, I can, worry about it. I can't do anything about it. So
no, that's why I turn my TV off. I turn my TV off. I don't watch TV.
I'm I'll let the people do their work in the politics space, and I'll do my work in the longevity space. But,
that's right.
It's I can only put my energy towards so much, and it's really important where you put your energy. So
Absolutely.
yeah. Well, thank you so much for coming on the podcast, taking the time out of your day. This was so great. And hopefully we can get the word out about nitric oxide and the oral microbiome.
Absolutely. Thank you.
Thank you.